Magnetic resonance imaging, MRI, is a medical imaging technique used in radiology to generate pictures of the anatomy and the physiological processes inside the body. MRI scanners use strong magnetic fields, magnetic field gradients, and radio waves to form images of the organs in the body. MRI does not involve X-rays or the use of ionizing radiation, which distinguishes it from computed tomography, CT, and positron emission tomography, PET, scans. MRI is a medical application of nuclear magnetic resonance, NMR, which can also be used for imaging in other NMR applications, such as NMR spectroscopy. MRI is widely used in hospitals and clinics for medical diagnosis, staging, and follow-up of disease. Compared to CT, MRI provides better contrast in images of soft tissues, e.g. in the brain or abdomen. However, it may be perceived as less comfortable by patients, due to the usually longer and louder measurements with the subject in a long, confining tube, although open MRI designs mostly relieve this. Additionally, implants and other non-removable metal in the body can pose a risk and may exclude some patients from undergoing an MRI examination safely. MRI was originally called NMRI, nuclear magnetic resonance imaging, but nuclear was dropped to avoid negative associations. Certain atomic nuclei are able to absorb radio frequency, RF, energy when placed in an external magnetic field. The resultant evolving spin polarization can induce an RF signal in a radio frequency coil and thereby be detected. In other words, the nuclear magnetic spin of protons in the hydrogen nuclei resonates with the RF incident waves and emit coherent radiation with compact direction, energy, frequency, and phase. This coherent amplified radiation is then detected by RF antennas close to the subject being examined. It is a process similar to masers. In clinical and research MRI, hydrogen atoms are most often used to generate a macroscopic polarized radiation that is detected by the antennas. Hydrogen atoms are naturally abundant in humans and other biological organisms, particularly in water and fat. For this reason, most MRI scans essentially map the location of water and fat in the body. Pulses of radio waves excite the nuclear spin energy transition, and magnetic field gradients localize the polarization in space. By varying the parameters of the pulse sequence, different contrasts may be generated between tissues based on the relaxation properties of the hydrogen atoms therein. Since its development in the 1970s and 1980s, MRI has proven to be a versatile imaging technique. While MRI is most prominently used in diagnostic medicine and biomedical research, it also may be used to form images of non-living objects, such as mummies. Diffusion MRI and functional MRI extend the utility of MRI to capture neuronal tracts and blood flow respectively in the nervous system, in addition to detailed spatial images. The sustained increase in demand for MRI within health systems has led to concerns about cost-effectiveness and overdiagnosis. MRI has a wide range of applications in medical diagnosis and around 50,000 scanners are estimated to be in use worldwide. MRI affects diagnosis and treatment in many specialties, although the effect on improved health outcomes is disputed in certain cases. MRI is the investigation of choice in the preoperative staging of rectal and prostate cancer and has a role in the diagnosis, staging, and follow-up of other tumors, as well as for determining areas of tissue for sampling in biobanking. MRI is the investigative tool of choice for neurological cancers over CT, as it offers better visualization of the posterior cranial fossa, containing the brainstem and the cerebellum. The contrast provided between gray and white matter makes MRI the best choice for many conditions of the central nervous system, including demyelinating diseases, dementia, cerebrovascular disease, infectious diseases, Alzheimer's disease, and epilepsy. 31, 32, 33 Since multiple images are taken milliseconds apart, it can show how the brain responds to different stimuli, enabling researchers to study both functional and structural brain abnormalities in psychological disorders. MRI also is used in guided stereotactic surgery and radiosurgery for treatment of intracranial tumors, arteriovenous malformations, and other surgically treatable conditions using a device known as the N-localizer. New tools that implement artificial intelligence in healthcare have demonstrated higher image quality and morphometric analysis in neuroimaging with the application of a denoising system. The record for the highest spatial resolution of a whole intact brain, post-mortem, is 100 microns, from Massachusetts General Hospital. The data was published in Nature in October 2019. Though MRI is used widely in research on mental disabilities, based on a 2024 systematic literature review and meta-analysis commissioned by the Patient-Centered Outcomes Research Institute, PCORI, available research using MRI scans to diagnose ADHD showed great variability. The authors conclude that MRI cannot be reliably used to assist in making a clinical diagnosis of ADHD. Cardiac MRI is complementary to other imaging techniques, such as echocardiography, cardiac CT, and nuclear medicine. It can be used to assess the structure and the function of the heart. Its applications include assessment of myocardial ischemia and viability, cardiomyopathies, myocarditis, iron overload, vascular diseases, and congenital heart disease. Musculoskeletal applications in the musculoskeletal system include spinal imaging, assessment of joint disease, and soft tissue tumors. MRI techniques can also be used for diagnostic imaging of systemic muscle diseases including genetic muscle diseases. Swallowing movements of the throat and esophagus can cause motion artifacts over the imaged spine. Therefore, a saturation pulse applied over this region can help to avoid these artifacts. Motion artifacts arising due to the pumping of the heart can be reduced by timing the MRI pulse according to heart cycles. 47 blood vessel flow artifacts can be reduced by applying saturation pulses above and below the region of interest. Liver and gastrointestinal. Hepatobiliary MRI is used to detect and characterize lesions of the liver, pancreas, and bile ducts. Focal or diffuse disorders of the liver may be evaluated using diffusion-weighted, opposed phase imaging and dynamic contrast enhancement sequences. Extracellular contrast agents are used widely in liver MRI, and newer hepatobiliary contrast agents also provide the opportunity to perform functional biliary imaging. Anatomical imaging of the bile ducts is achieved by using a heavily T2-weighted sequence in magnetic resonance cholangiopancreatography, MRCP. Functional imaging of the pancreas is performed following administration of secretin. Mr. Enterography provides non-invasive assessment of inflammatory bowel disease and small bowel tumors. MR colonography may play a role in the detection of large polyps in patients at increased risk of colorectal cancer. Magnetic resonance angiography, MRA, generates pictures of the arteries to evaluate them for stenosis, abnormal narrowing, or aneurysms, vessel wall dilatations, at risk of rupture. MRA is often used to evaluate the arteries of the neck and brain, the thoracic and abdominal aorta, the renal arteries, and the legs, called a runoff. A variety of techniques can be used to generate the pictures, such as administration of a paramagnetic contrast agent, gadolinium, or using a technique known as flow-related enhancement, example 2D and 3D time-of-flight sequences, where most of the signal on an image is due to blood that recently moved into that plane. See also flash MRI. Techniques involving phase accumulation, known as phase contrast angiography, can also be used to generate flow velocity maps easily and accurately. Magnetic resonance venography, MRV, is a similar procedure that is used to image veins. In this method, the tissue is now excited inferiorly, while the signal is gathered in the plane immediately superior to the excitation plane, thus imaging the venous blood that recently moved from the excited plane. MRI is, in general, a safe technique, although injuries may occur as a result of failed safety procedures or human error. Contraindications to MRI include most cochlear implants and cardiac pacemakers, shrapnel, and metallic foreign bodies in the eyes. Magnetic resonance imaging in pregnancy appears to be safe, at least during the second and third trimesters if done without contrast agents. Since MRI does not use any ionizing radiation, its use is generally favored in preference to CT when either modality could yield the same information. Some patients experience claustrophobia and may require sedation or shorter MRI protocols. Amplitude and rapid switching of gradient coils during image acquisition may cause peripheral nerve stimulation. MRI uses powerful magnets and can therefore cause magnetic materials to move at great speeds, posing a projectile risk, and may cause fatal accidents. However, as millions of MRIs are performed globally each year, fatalities are extremely rare. MRI machines can produce loud noise, up to 120 dB. This can cause hearing loss, tinnitus, and hyperacusis, so appropriate hearing protection is essential for anyone inside the MRI scanner room during the examination. Medical societies issue guidelines for when physicians should use MRI on patients and recommend against overuse. MRI can detect health problems or confirm a diagnosis, but medical societies often recommend that MRI not be the first procedure for creating a plan to diagnose or manage a patient's complaint. A common case is to use MRI to seek a cause of low back pain. The American College of Physicians, for example, recommends against imaging, including MRI, as unlikely to result in a positive outcome for the patient. An MRI artifact is a visual artifact, that is, an anomaly during visual representation. Many different artifacts can occur during magnetic resonance imaging, MRI, some affecting the diagnostic quality, while others may be confused with pathology. Artifacts can be classified as patient-related, signal processing dependent and hardware, machine-related. MRI is used industrially mainly for routine analysis of chemicals. The nuclear magnetic resonance technique is also used, for example, to measure the ratio between water and fat in foods, monitoring of flow of corrosive fluids in pipes, or to study molecular structures such as catalysts. Being non-invasive and non-damaging, MRI can be used to study the anatomy of plants, their water transportation processes and water balance. It is also applied to veterinary radiology for diagnostic purposes. Outside this, its use in zoology is limited due to the high cost, but it can be used on many species. In paleontology, it is used to examine the structure of fossils. Forensic imaging provides graphic documentation of an autopsy, which manual autopsy does not. CT scanning provides quick whole-body imaging of skeletal and parenchymal alterations, whereas MR imaging gives better representation of soft tissue pathology. All that being said, MRI is more expensive, and more time-consuming to utilize. Moreover, the quality of MR imaging deteriorates below 10 degrees Celsius. In 1971 at Stony Brook University, Paul Lauterbur applied magnetic field gradients in all three dimensions and a back projection technique to create NMR images. He published the first images of 2 tubes of water in 1973 in the journal Nature, followed by the picture of a living animal, a clam, and in 1974 by the image of the thoracic cavity of a mouse. Lauterbur called his imaging method sigmatography, a term which was replaced by NMR imaging. In the late 1970s, physicists Peter Mansfield and Paul Lauterbur developed MRI-related techniques, like the echoplanar imaging (AP) technique. Raymond Damadian's work into nuclear magnetic resonance (NMR) has been incorporated into MRI, having built one of the first scanners. Advances in semiconductor technology were crucial to the development of practical MRI, which requires a large amount of computational power. This was made possible by the rapidly increasing number of transistors on a single integrated circuit chip. Mansfield and Lauterbur were awarded the 2003 Nobel Prize in Physiology or Medicine for their discoveries concerning magnetic resonance imaging. Magnetic resonance imaging, MRI, is a game changer in the field of medical diagnostics. This non-invasive imaging technology provides incredibly detailed images of the body's internal structures, aiding in the diagnosis and treatment of various conditions. Whether you're a patient scheduled for an MRI or simply curious about how this technology works, this comprehensive guide will walk you through everything you need to know about MRI. MRI, or magnetic resonance imaging, has revolutionized the way we view and understand the human body. Unlike other imaging techniques, MRI does not use ionizing radiation, making it a safer option for many patients. In this guide, we'll explore the science behind MRI, its various applications, the benefits and risks, and what you can expect during an MRI procedure. MRI is a powerful and versatile imaging tool that has significantly advanced medical diagnostics. Understanding how MRI works, its benefits, and what to expect during the procedure can help alleviate any concerns and prepare you for a successful scan. Always consult with your healthcare provider to determine if MRI is the right imaging modality for your condition. Thank you for watching this video.